It is my pleasure to introduce the Interim President of the Claremont Graduate University. And I don't say that lightly, that it's my pleasure. Joe came in a little over a year ago at a time that was a very critical period for the whole university, but especially for the brand new startup school of Community and Global Health. We'd had the financial collapse in the country. Our standing here at the university was still a little shaky, and Joe has done an extraordinary job of stabilizing things for us. Let's tell you a couple of things about Joe. Joe is an ethicist, has his degree, his PhD in that degree from Yale. He was a Wake Forest BA. He has directed a research center, and immediately before coming here was president of the Union Theological Seminary. Actually, not quite immediately, because he had just gone into retirement from that. And then when we had a loss of leadership here at CGU, a couple of members of our board of trustees knew Joe from the Union Theological Seminary and said, "This man is remarkable and will be just what we need to get us over the hump here." Joe's a true intellectual in the best sense. He seems to read everything. He has strong, very strong convictions, but is persuadable, thank God. Because Joe really came in, knew nothing about us, and questioned whether it was the right thing, I think, for us, for us and for the university initially, and then saw that it was and made sure that we were successful. Joe, thank you very much.
Thank you, Andy. If you take that, I'd like a copy of it.
You're taking everything.
Yeah.
It's a pleasure to be able to welcome all of you here. I wish I could be with you, but you will understand that in about 20 minutes I have a Business and Finance Committee meeting with the Board of Trustees, and I do have to be there, because you never know what trustees are going to do unless you're there. And if you're there, sometimes you can't do anything about it, so it's better to be aware. In any case, I think this conference signals something for me. You know, as I grew up mostly in the 20th century, the preoccupation among health professionals, and by the way, my wife and youngest son, my wife is a nurse practitioner, my son is a physician, and his wife is. So the preoccupation with healthcare systems, with research, and with visionaries were essentially epidemics of infectious diseases. That's what the 20th century really worked on the most. I remember polio, a huge national effort to support the Salk lab when they developed the polio vaccine, and the incredible progress they made so that polio now practically doesn't exist where that vaccine is available. A huge malaria epidemics that recurred repeatedly in Africa. There are now simple cures for malaria. There are strategies in place to take care of those kind of things. The problem of delivery of health care in areas of high epidemic danger, like Haiti, for example. That crisis was met by the incredible ingenuity of a doctor named Paul Farmer, Partners in Health, who has, in my opinion, created the only viable global health system for poor countries that I've ever heard about. And he is now working in Rwanda, and after Rwanda will move on to another country. And what he does is leave behind people he's trained to carry on the health system, and they have to be done at minimal cost in respecting the local culture. But all of that had to do with dealing with epidemic diseases. And of course, tuberculosis used to be a big killer. And that's treatable at this point if you get it in time. Now, as I see this program, and as I watch the research focus of many institutions and research centers in this country, I see a focus now on what I would call health endangerment conditions such as obesity. And these are health care prevention programs. They are lifestyle programs. They're educational programs. You can no longer focus on health care under this new rubric without including education, research, treatment, and monitoring in order to achieve an effective result. I congratulate you on your focus in this conference. I think it is one of another important conference that will move us along in a very important direction if we're to deal with problems that affect global health. For you of course know the correlation between certain habits of life and early death. The odds of a person, for example, having a heart attack go up quite significantly. There are, of course, ethnic differences, but they go up quite significantly if people are chronically overweight and don't control their weight and don't control their eating habits. That's just one. There are hundreds. I'm not trying to make a speech, just to welcome you and tell you all how glad I am that you are here at the School of Community Global Health in Claremont. We're pleased and we're privileged to have those of you who are with us as our guests. So I hope you have a good day. I just wish I could be with you. I know I'd learn a lot, but I can count on Andy to tell me about the good things. So I will get the residue of your deliberations. Hope you have a good day, and thank you for inviting me to come along and just say welcome to Claremont.